And again, we're broadcasting about Lyme disease, and thank you for putting up with all my technical difficulties. And it's going to be a series of lectures about Lyme disease, and we're going to go through different aspects. We're going to keep it short, hopefully not have too many sound issues. And I'm going to go over the outline right now. And hopefully you're going to be able to see some of these posts. I'm looking over here so I can see your posts if you got questions or anything. And if we don't answer it today, we can always answer more later on. So again, in order to start over again in some ways, it's going to be Lyme disease, a whole body approach. Okay? And my outline. Today we're going to talk about what is Lyme disease, and then clinical signs and symptoms. So that's going to be our topics for today. We'll be getting into conventional testing and treatments next time. And then following that, start talking about whole body approaches. So my philosophy on Lyme and my ability to help patients and some of the things that we utilize for whole body approaches, such as EAV testing, helping with removing the obstacles getting somebody better, homeopathy, botanical medicine, detox, alternative antimicrobial therapies, and of course hyperbaric oxygen. So we'll talk about that a little bit going forward. But today, I want to start off with a very interesting thing. Okay, let's start off with a test. I know you came into this and said, hey, I didn't know I'm going to have to take a test, but you're actually going to have to take a test. So what I want you to do is watch this for a moment.
This is an awareness test. How many passes does the team in white make?
Go!
The answer is 13. But did you see the moonwalking bear?
Go!
So it is easy to miss something you're not looking for. And I think this is very key for Lyme disease because it's difficult. It shows up in many different ways. So if a doctor isn't trained what to look for, they're going to miss it. So I want to talk first, after our test here, about a case that came to me a few years back for hyperbaric oxygen therapy. Now, this young girl, 14 years old, she was in July, was pushed into a wall while swimming. And so they thought this was, a concussive injury. Just that makes sense, right? She had head pain, dizziness, pain in the shoulders and back, and severe tightening of her muscles. Sensitivity to light and noise. And by August, her vision was getting blurry and tingly in her arms and legs, and she had increasing fatigue. So that's interesting. But then by mid-November, she had trouble concentrating, and she had a lot of physical weakness. Now, she had other symptoms, like ringing in her ears. Her stomach started feeling sick, and she didn't eat, and difficulty swallowing. And her head pain and other symptoms, really, that just kind of baffled a neurologist. They did MRIs, CTs, EEGs, look at angiographies, MRAs, blood work, all was coming back negative. So what was going on with this girl? And was it just a head injury? Again, this patient came to me for a concussive injury, because we do hyperbaric oxygen therapy here. And again, we'll talk about that at some point too. So I used EAV technology, and I did something called biological signal analysis to see what this might be. And I started finding signals for all these different things. Heavy metals and pesticides, and I started finding signals for tick-borne diseases like Babesia, Borrelia, Mycoplasma. And then we started doing a therapy on her to treat her Lyme. And she started having die-off symptoms, bacterial die-off symptoms known as a Jerich's-Herxheimer reaction, or as people in the Lyme world call it, the Herx. So she started having that. So we have to say, what is Lyme disease? And where did it start? So it started back in 1975 in Old Lyme, Connecticut, not too far from where we are right now, where I'm broadcasting from in Fairfield, about an hour east of here. And it was a bunch of kids getting arthritis, which of course is unusual. Kids shouldn't be getting arthritis. And what was found eventually was that it was an infection. And what were the causes? Actually, at Yale, they found it was this spirochete called Borrelia burgdorferi. Okay, so Dr. Burgdorferi, he named it after himself, of course, why not? They were the first to diagnose this tick-borne disease. And there it is, you can see it on the screen. It's this spirochete type of organism, looks like a corkscrew, and it can kind of burrow into tissues and start setting up shop and causing inflammation and a whole host of other things. And it's transmitted mostly by this tick called the Ixodes scapularis. Okay, it's also known as the deer tick, but it doesn't only get spread by that. And it can go from field mice and other animals in the spring, get carried by any warm-blooded animal, really. And depending where you live, anywhere between 1% to 90% or more of these ticks can be infected or carrying this spirochete. So here you see they just kind of hang out on blades of grass and other brush, looking for someone to come by. And look at that. Look at the size variance. Now, what you see there on the left is a nymph. Those are the little tiny guys. Now, at this time of year, they are really one of the things that you may find. I actually just pulled this off of somebody the other day. I mean, it's like, oh, that's just like a little tiny blip. What is that going to do? I mean, that's the size of like a tip of a pencil. But they will transmit Lyme disease. And then they grow up a little bit. And then they grow up more. And finally, they get to the one that probably everyone's seen, which is the one on the far right. And then they'll just burrow in and drive their jaws in and start sucking on your blood. Nice, right? And there's different rashes that can occur. Doesn't mean it's going to occur, but it can occur. Such as and 3 to 30 days later, people can get these rashes, but less than 50% of people or even recall getting bitten, and it doesn't happen with everybody. But it can start expanding, 12 inches or more. It can start feeling warm to the touch, and it's really usually not itchy or painful. And the bullseye, all right? That is the hallmark sign. And that what everyone looks for is this, kind of bullseye rash. But here's some ideas that it doesn't always look just like that. For instance, that's more of the classic bullseye rash. There's one that looks kind of a little infected. Just you don't really see the bullseye outside of that crustiness in the middle. Here it's on someone's side, so it just kind of looks like a rash. And then there is another way of looking, another form of the rash can take. Here's it's behind someone's knee, and gosh, that doesn't look like a rash necessarily. And there's a bunch of them kind of all on this person's back. But several days later, they can start feeling flu-like symptoms. They can start having fatigue, aches, pains, muscle aches, tendon, joint swellings, facial palsy, shortness of breath, shooting pains in their arms, and numbness, tingling, short-term memory problems, low-grade fever. I mean, these are all signs that can start occurring. And it doesn't have to necessarily be with the rash, but it can be. And it's known as the great imitator. And it can occur, like these symptoms can start occurring in all different parts of the body. I mean, we could see over here, we have jaw, all right? People can have jaw pain, tooth pain, bladder issues. So it could be everything from just, urgency, pain in the bladder, cystitis sometimes can be diagnosed as, just a lot of frequent urination, lung issues, ears. They can feel problems with their ears. They can think there's infections. I know some people have gotten bitten right behind the ear, and then eventually, oh, that's not a big deal. Then later on, my ears are hurting. Could be again, a few days, weeks later, and they think they have an ear infection, but it's not an ear infection. It's a Lyme infection. Throat, even like that patient before we looked at, difficulty swallowing or just feeling like they have a sore throat, and may think they have strep, in which case they may be put on an antibiotic, which may be a good thing, depending, but usually won't be treated at the high enough dose for long enough if they're just thinking strep versus Lyme. Stomach problems, heart issues, fibrillations, things like just feeling tightness in the chest, and other issues like that. Skip beats. Neuropsychiatric, this is a big one, a really overlooked symptom that can occur with Lyme disease, and that's with everything from anxiety to depression, rage. It can happen with pregnancies, get transmitted. You can have skin manifestations. So the list kind of goes on and on as far as what can go on with Lyme. Let's see some examples. Okay, it can attack the joints, and look at that here. You can see that they have swollen joints. I don't remember getting hurt. The nerves, you can get like a facial palsy, like a Bell's palsy. The eyes, okay, you can even see in the eyes, you can get something called uveitis. So that's not good. Could be quite dangerous, actually. Even little babies can unfortunately get injured here. So you see that. And there's the poor little kid afterwards. And even animals, even little animals can get Lyme disease. And the vets pick up on this type of thing a lot. So, and here's just some examples of some of the symptoms that can occur. I'll let you look at that for a second. But you can see almost anywhere in the body. It can have everything from just your fevers and joint pains and that rash like everyone's talking about, to the difficulty concentrating, word-finding problems. I can't remember things anymore. I'm saying things strangely, sound like I'm slurring my speech. It could be anything. Psychosis, paranoia, bipolar, depression, anxiety, light sensitivity, sound sensitivity, feeling like you're off balance, weight gain, problems with thyroid, fatigue, stamina, dental pain. The list goes on and on. Night sweats. It's really, that's why we call it the great imitator. And it is out there. It's so much. Each year, 30,000 cases are reported into the CDC. So think about that. 30,000 cases are reported, but they feel it's probably only 1 in 10 cases actually get reported. And that means there's probably over 300,000 cases diagnosed per year. And remember I told you it's hard to actually see those cases? Well, what happens if they're being missed? So what are the numbers really? It could be a lot higher. And reported cases, you could see it's just been going up and up and up over the years. And the light blue is saying it's the probable cases. So it's even more, obviously. And then we're saying it may be even higher than that. And you'll start understanding that when we get into ideas about testing. And here's a distribution about when it occurs. I mean, you could see the kids, 5 to 10-year-olds and 15-year-olds, they're going to have, it's a big spike because kids are outside, they're playing, they're running around. And in your 20s, life gets boring and you're working and you're trying to make a living and you're not playing outside so much, so that probably dips down. And then by your 40s and 50s, you're just like, I got to get outside more and start exercising. So perhaps that's one of the reasons that it starts peaking 40s and 50s and then eventually goes down from there. Again, these are just a distribution as far as the diagnosed cases, and males tend to be diagnosed a little bit more than females. Again, who knows? Maybe that's just because they're getting diagnosed more, or maybe because they're outside more. So, and we can see here the times of year when it gets diagnosed, and it's obvious the summer and spring months would be the highest times of diagnoses. But you can also see that it goes all the way out there through the winter because people can become symptomatic later on and may not have been diagnosed. And that's when they're actually getting their diagnosis. And so our next broadcast, we're going to talk about testing. All right. So that will be what we'll be discussing next time, is about testing. Here's my face again, right? So I'm going to look over here and see if anyone has any questions that have come up. I'm not exactly certain if I'm doing this right. I'm going to go look at my little phone here as a way of sort of tagging in. So let me just give you a moment if anyone has any questions. I tell you all the technical stuff we're going to be figuring out. I'm sure it'll get better and better with time. But I have to see what we can do. Alrighty here. Come on. Facebook. Now if Jen is still in the building or something, but if you're there, Jen, you can pop over and let me know if there's any questions people have, because we want to be able to answer them if you got any questions. Let me see. All right. By the way, I see Kathy was there, Louisa, and got a few people online right now. Of course, these broadcasts will be available, still on Facebook, and we're also streaming to our Breiner Whole Body Health Center YouTube page. So make sure that you go to our YouTube page and like us on Facebook. Go to the YouTube page. Make sure you hook into that channel there, because we'll be doing more broadcasts about Lyme, but we'll also be doing longer segments where we may talk about other topics. And also our NeuroEdge page, Facebook page, you can click to that too, like that, follow that, because we'll be talking there a little bit more about brain related topics. So anyhow, I want to thank you for joining me today. And again, next time we'll be discussing testing. And this will be a great time to say goodbye and have a great weekend.